everyone. My name is Tamara Srinath, and I'm a physician assistant working with Dr. Wasim Haq at North Texas Diabetes and Endocrinology. Today's video is part of a series focusing on different medications for diabetes. Today, we will be discussing OZEMPIC, which is part of the GLP-1 receptor agonist group of medications. These are medicines that act like a natural and normal hormone called GLP-1. GLP-1 is part of a group of hormones made by our intestines called incretins. Incretins tell our pancreas to make insulin, a hormone that lowers blood sugar and also suppresses glucagon, which acts opposite to insulin. Incretins also slow down the speed at which our stomach empties food into the intestine and thus slows the rise of blood glucose after we eat. Incretins also act on the brain to promote fullness. People with diabetes have a decreased incretin effect. The medicines in this group help reduce the incretin action to help reduce blood glucose levels. GLP-1 agonists are great agents for those who are overweight or obese. Overweight or obese patients generally lose, on average, about 6.5 pounds. They also have cardiovascular benefits, so they are an excellent choice for those at risk or with known heart disease. These meds are also effective at controlling blood glucose with a low risk of development of hypoglycemia. As there is some possible benefit on beta cell function, these meds are an excellent choice for those with relatively early diagnosed type 2 diabetes. How and when to take OZEMPIC? Generally, your healthcare provider will initiate OZEMPIC at the lowest dose of 0.25 milligrams once per week. You can take OZEMPIC at any time of the day, irregardless of food. After 4 weeks, the dose may be increased up to 0.5 milligrams once per week, as long as the medication is tolerated. After an additional 4 to 12 weeks, your provider will determine if the dose should be increased to 1 milligram once weekly. The 1 milligram dose of OZEMPIC is a different pen than the titration OZEMPIC pen, which includes a 0.25 milligram and 0.5 milligram doses. At each interval of dose adjustment, your healthcare provider will assess if the dose needs to be titrated down depending on the severity of severe gastrointestinal side effects, such as nausea. Dosage adjustments should be made slowly. If you are unable to tolerate a titration up, continuing on the lower dose for a longer period of time may improve tolerability. Be patient and keep your healthcare provider informed.
I'll be demonstrating how to use the OZEMPIC pen. So here we have a 0.5 milligram pen, and this is the normal starting pen for most patients. And we'll be going through the different parts of the pen first. So this is the pen cap. To start using the pen, you're going to remove it. And this is the main body of the pen. And as you can see, there's the medication in there. If it's cloudy at all, you should not use the pen. And as you can see, we are also going to need a needle for injection. So each pen comes with these little pen caps or needle tips to use, and they should only be used once. So next up, we have our dose selector, and this is a dial at the end that's going to allow you to dial up the dose when you're injecting for whatever prescription you have. So the first step is to prime the needle, and priming the needle means filling it with medication in order to ensure that you're getting the correct amount when you inject. So this first little dial says ... these two little dots, and this is going to allow you to prime the pen, and we'll demonstrate how to do that in a minute. The next dose up is 0.25. For most people, they'll start at this dose and often will increase to 0.5 milligrams. So that's the next dose up. So now I'll be demonstrating how to use it, and this is the dose injector right here. So we're going to dial back down. So the first step is to swab your injection site with an alcohol swab. So this will be either your abdomen or your thighs. So we'll swab this. And once it's dry, you will take your pen and you're going to remove the pen cap. So now we'll be putting on the the needle tip. So you can remove this paper here, just like this. And we will be screwing it onto the top of the pen. So you'll press down, screw to the right until it's tight. See? Then you will be removing the outer cap of the needle tip, and it just pulls off like that. As you can see, there's another little cap on there, and this is going to be covering the needle. So we'll pull that off. As you can see, the needle is on. So now we're going to dial up our dose. If you're on a starting dose, we're going to dial up to prime the pen first. And you'll only prime the pen on the first use of each pen. So the second time you use the pen, you're not going to have to prime it. So we'll dial up to these 2 dots, and we are going to be pressing the button. And as you can see, little dot of medication, little drop is at the tip, and that's how you know the needle has been primed, is if the medication has formed a droplet at the tip of the needle. Once that is primed, you're going to dial up to your dose. So let's say we'll dial up to 0.25. You'll look at your injection site, either your abdomen or your thighs, and we will be injecting perpendicularly into the skin. You'll be pressing this button, and after it's injected, you're going to count to 6 to make sure that the medication is all the way absorbed and injected. So we'll press the button. As you can see, we've hit the 0, and now we're going to count down 6, 5, 4, 3, 2, 1. Remove the pen. You are going to remove the needle tip with the large cap. Be very careful. Unscrew this. And this can be stored in the fridge if you're going to use it again. And the needle tip will be disposed of in a sharps container.
This slide demonstrates all the locations for OZEMPIC to be injected, including the abdomen, arms, thighs, and above the buttocks. Remember to rotate your injection sites. Storage and handling of OZEMPIC. OZEMPIC should be stored in a refrigerator. The pen can be kept at room temperature for up to 56 days. Keep the pen out of direct heat and light. Dispose of pen needles in a puncture-resistant sharps container. Who should not take a GLP-1 agonist? These are not good options for patients with a history of pancreatitis. These agents are also contraindicated in patients with a personal or family history of medullary thyroid cancer, which is a very uncommon type of thyroid cancer, or multiple endocrine neoplasia too. These agents are also not good for patients with severe GERD or gastroparesis, or those at risk for fluid depletion. The most common side effects of this class of medications are generally gastrointestinal, which include nausea, vomiting, diarrhea, and heartburn. Generally, GI side effects get better over time. However, if a patient reports severe abdominal pain or vomiting, we do ask that they immediately discontinue these medications, as there is a very rare risk of development of pancreatitis. When combined with some other medications, such as sulfonylureas, glipizide, glyburide, glimepiride, or insulins, there is also a risk of hypoglycemia, or low blood glucose. For injectables, there is a potential for injection site reactions. Potential advantages for the GLP-1 class of medications are numerous. One of the greatest benefits is weight loss and appetite suppression. GLP-1 medications help you feel full after a meal, which causes you to eat less. This is especially helpful in glycemic control, as weight loss is a mainstay of diabetes management. For those at risk for hypoglycemia, GLP-1 agonists act only when the blood glucose is elevated. Unless they are combined with other agents, as discussed earlier, they generally do not cause hypoglycemia. Studies have also demonstrated a cardiovascular or heart benefit of these agents. Type 2 diabetes is a progressive disease characterized by insulin resistance and a decrease in the pancreatic beta cell function. There is some data that GLP-1 agonists may help prevent further beta cell decline, which means that they may prevent progression of diabetes. Some of the most frequently asked questions for Ozempic include traveling. Remember, you may store your pen at room temperature for up to 56 days, as long as it is kept away from direct heat and light. Therefore, you should be safe to travel with Ozempic as long as it remains on your carry-on luggage during a flight. If you miss a dose of Ozempic, you can take the injection as long as it is within 5 days of the missed dose. In conclusion, Ozempic can be used as a potential first or second-line agent in the management of your diabetes. It is also associated with significant weight loss, which is a cornerstone of diabetes management. And finally, Ozempic has been shown in some clinical trials to be associated with decreased risk of heart attack or stroke. Please remember, this video is to be used for informational purposes only and not to be used as a substitute for consultation with your provider. Please be sure to address any questions or concerns regarding your medical management with your provider. Thanks again for joining us, and good luck.